The information provided in the Golden Nuggets health and wellness shows, including but not limited to advice, tips, and discussions on mental, physical, and spiritual well-being, is intended for general information purposes only. It is not a substitute for professional advice or treatment. The Golden Nuggets health and wellness shows are designed to inspire and inform, promoting a holistic approach to health for the mind, body, and soul. However, individual circumstances vary, and what works for one person may not be suitable for another. Before making any significant changes to your lifestyle, diet, exercise routine, or adopting new practices discussed on the show, it is strongly recommended that you consult with qualified healthcare professionals, nutritionists, or other relevant experts. They can provide personalized advice based on your specific needs, health status, and any existing medical conditions. The host, guest, and producers of the Golden Nuggets health and wellness shows do not assume responsibility for any consequences arising from the use or misuse of the information provided. Viewers and listeners are encouraged to use their discretion and take responsibility for their own health choices. By engaging with the Golden Nuggets health and wellness shows, you acknowledge that the content is not a substitute for professional advice and that you will seek the guidance of qualified professionals when needed. Thank you for being a part of the health and wellness community.
Welcome to Golden Nuggets Health and Wellness Show, the television program that's redefining self-care for the mind, body, and soul. I'm Dr.-elect Starr. I'm a licensed mental health counselor, health and wellness consultant, and your host for this show. Our mission is simple: to empower you with creative and innovative self-care strategies that help you prosper and be in good health even as your soul prospers. In our first segment, entitled Compassion Fatigue, the Cost of Caring, we dive into the emotional and physical exhaustion experienced by helping professionals. We explore what compassion is, who's at risk, its signs and symptoms, and most importantly, the steps to address and prevent it. Today, our focus is healthcare professionals and compassion fatigue. But before we begin, allow me to introduce our esteemed guest, Janice Akers Reinhardt. She is a RN and she works nurse professional partnership. We're so glad to have you on our show today, Janice. Thank you for being here. Could you tell us a little bit about you and what you do?
So again, my name is Janice Akers Reinhardt. I am a nurse home visitor, so it's sort of essentially like a public health nurse. But I specifically work with first-time pregnant moms. We have recently began to work with multiples, with women that have had more than one children, but my focus is working with first-time pregnant moms, trying to lay a foundation for them to be a strong mom, to give birth to a strong baby, and ultimately create strong communities. That's the goal.
What a wonderful role. Well, thank you for your service. We appreciate you. And we're going to start this program off by just talking about compassion fatigue. And perhaps you're wondering, well, what is compassion fatigue? Compassion fatigue is a gradual lessening of compassion for yourself and for others. It's a profound emotional, physical, and mental exhaustion, and it occurs over time as you care for others. Compassion fatigue can have a detrimental impact on individuals, both professionally and personally. For example, it can cause a decrease in productivity and cause absenteeism. It can also prevent you from focusing, and it can cause some, what we call development of new feelings of incompetency and even self-doubt. So it's very important that healthcare professionals understand what compassion fatigue is and also understand the impact of compassion fatigue. I want to share at this time those who are at risk. Perhaps you're wondering, well, am I at risk for developing compassion fatigue? First of all, anyone in the helping field can be profoundly affected by compassion fatigue. Also, those who are in what we call direct exposure to trauma victims, such as policemen, paramedics, and firefighters. But last, those who are what we call experiencing indirect. They're not involved in the trauma, but they are supporting individuals who have experienced trauma. And so that includes nurses, such as Janice, doctors, clergy's wives, teachers, yes, teachers, and it also includes caregivers. So these are just some of the individuals who are potentially impacted by compassion fatigue. I want to ask Janice a question at this time. Could you share a personal experience or story that illustrates how compassion fatigue has affected you or your work?
Sure. You know, one that comes to my mind immediately is this particular mom that I was working with. Actually, she still is my patient, my client. But she had a lot of background situations. Not only was she pregnant, and she smoked, so trying to work her through that. She had some food insecurities. She had some other health issues going on. And it could be, and I could go into the string of things that she was experiencing, but in her experiencing it, I'm trying to provide the resources, the help and the support for her during that period of time. But it seems like that I was doing all the giving, but she wasn't reciprocating. She wasn't actually taking hold and grasping anything I was presenting to her. So, and I would visit her weekly, and I would come back and she was still in the same position. She didn't take some of the suggestions or the recommendations for food pantries. I'd even sat there one day and even went through and set her up for a dental appointment. She had a serious dental problem going on, and she failed to keep it. But what I found is I'm trying to give and give and give, and her not really trying to work with me. It became very, very tiring and very disappointing, and it was a challenging situation. And I think what I ultimately did, I talked to my immediate supervisor about it, but what I personally did on my own is that I've given her the resources, I've given her the help that she needs. She needs to grasp it. And so what I did was I just backed off. And just backed off for a while, let her sort of stew in what she had to work with. And eventually she called me and she's like, so when is our next appointment? So, but it still sort of got her going, but I had to realize that I was giving more of myself than I was actually being able to make an impact in her life. So I had to walk away. And it wasn't walking away meanly. It wasn't, I don't want to have anything else to do with you, but just let her work with what I had, but I had to take care of me.
Absolutely, absolutely. So you did what we call set healthy boundaries.
I believe in that. That's exactly what it is.
Yes, and that is one of our coping skills that we'll be talking about. So I'd like to now just bring to your attention some of the warning signs. Perhaps you're thinking, okay, so I know what compassion fatigue is, I know who's at risk, but what are the signs? How do I know I am experiencing compassion fatigue? Well, first of all, we did say it was an overwhelming feeling of exhaustion, mentally, physically, and emotionally. And it's the kind of exhaustion that a nap just doesn't quite get it. It happens over a period of time. And then there are feelings of helplessness and powerlessness in the face of patient suffering. You can imagine nurses, your work that you do, which I admire so much, day in and day out, supporting people who are suffering, hurting. I can imagine at times one could feel helpless or powerless. Then there's a reduced feeling of empathy and sensitivity. And we're not by any means suggesting that's what you were doing. You were setting boundaries, and there's a difference. Then there was what we call feeling detached, numb, or emotionally disconnected. Those are signs and symptoms. Increased anxiety, sadness, anger, and irritability. Difficulty concentrating and making decisions, and we said that earlier, inability to focus. Difficulty sleeping, and perhaps it's not just falling to sleep, staying asleep, or waking up early, are also signs and symptoms of compassion fatigue. Physical symptoms such as headaches, nausea, upset stomach, and dizziness, signs of compassion fatigue. Wow. Increased conflict in personal relationships. You can imagine that as well. If you're not able to focus, if you're not feeling well, if you're angry, irritable, frustrated,
Correct.
you can see how that can carry over into your home, personal relationships, loved ones' relationships, friends. And then there's a neglect of your own self-care. Now, I find this pretty common among helping professionals. They're so consumed with giving. And I always said that the higher level of your compassion, the greater the risk. It's because you care. You have a high capacity for caring, and as a result, high risk of compassion fatigue. There's also withdrawal and self-isolation. So these are all warning signs of compassion fatigue. And my question to you, Janice, is are there specific healthcare settings or roles that are more prone to compassion fatigue? And if so, why?
You know, I would certainly say yes, and you mentioned some earlier in your dialogue regarding some of the potential ones, but even one that came to my mind is social workers, or even those that, like my sister is a hospice coordinator. And I think what it is people that are a part of the healthcare field, at least I have to speak for myself and so many that I know, there is a genuine desire to really help and support and strengthen people as you can. And so you do sort of put yourself into a position where you're going to give more than you really have to give. So I think those particular ones, and even of course nursing, not only I do public health nursing, but you know, I've worked in the hospital as well. And even in those cases, you want to, and this is it, we tend to want to fix people. And we can't fix people, and have to come to that realization that we don't have the power to fix people. We can sort of lay a foundation to help them be better and get better, but we can't totally solve their issue. But and so I think that's what we do. We sort of go overboard.
That's good. That's good. I appreciate that. Thank you so much. We're going to take a break in a little bit, but I just want to piggyback on what you said about the tendency to want to fix people, and then the tendency to want to work harder than our client or our patients.
Yes.
And again, that's where those healthy boundaries come in.
Correct.
And what about recognizing your limitations?
Correct, yes.
You know, why are you there? I think that's important too, isn't it?
It is.
To help us stay focused.
Absolutely.
And I also sometimes talk to my clients and even colleagues about being careful not to have that Messiah complex. You find that in the helping profession?
Yes, but I think situations make you learn, okay, I am not that person. So it sort of pushes you back, and it makes you see the bigger picture. So yes, and I've learned, you know, through my career, and I'm one of those, when I went into nursing, I wanted to fix people, I wanted to help.
Yes.
But experience has taught me that I'm not their answer.
Absolutely. Well, thank you for your sharing. We're going to pause and take a break, and then we're going to come back, and we're going to just talk about the self-care plan. Okay, we're going to touch on that. I hope you're enjoying this show. I know I certainly am, and I appreciate Janice being here today. So we'll be right back. Stay tuned.
Dr. Starr, best-selling author of Golden Nuggets, Food for the Mind, Body, and Soul, is also a health and wellness speaker and consultant who provides motivational speaking, training conferences, and one-on-one coaching to improve the quality of life. She's passionate about helping people heal from the inside out. Dr. Starr provides creative and innovative self-care strategies that empower you to prosper and be in good health, even as your soul prospers. Call or visit the Golden Nuggets website today. Feeling anxious? Perhaps you're dealing with a past trauma and don't know where to turn for help. Turn to Unlimited Possibilities. We provide a safe and caring space for individuals and families to help improve the quality of their lives. Whether you need help with spiritual matters, trauma, depression, and more, Unlimited Possibilities can help you overcome your situation with compassion, acceptance, respect, and empowerment. Unlimited Possibilities, where all things are possible if you believe. Call or visit our website today.
Welcome back to Golden Nuggets Health and Wellness Show, food for the mind, body, and soul. For those of you just turning in, I am Dr. Starr, mental health counselor, health and wellness consultant, and your host for this show. We have been discussing compassion fatigue, the cost of caring. Our focus for today is healthcare professionals and compassion fatigue. And joining us today is Janice Akers Reinhardt, and she is an RN. We're so glad to have you today.
Thank you. Thank you very much.
Thank you for joining us.
My pleasure.
Thank you. Our pleasure, too. Well, we have been talking in the early part of the show about compassion fatigue. We've defined it. We have also examined the signs, symptoms of compassion fatigue. We talked about those at risk for experiencing compassion fatigue. This part of the show, we're going to focus a little bit on a self-care plan. We know now that there are warning signs of compassion fatigue.
Yes.
So then it would make sense for us to talk about a self-care plan. Would you agree?
I absolutely agree.
Well, it's essential for individuals in the caregiving and helping profession to recognize those signs and symptoms, but not just recognize them, take the steps to address and prevent it. So 3 things I'm going to talk about briefly today. But in our next show, Janice has agreed to come back, and we're going to really dive into the details of strategies for the self-care plan. But not only that, we're going to look at how compassion fatigue affects the healthcare profession. And so the first thing that is important is creating a self-care plan.
That's good.
That is absolutely necessary. Folks, my saying is, if you fail to plan, you plan to fail. And often, many of my clients, when they don't have a plan in place, they don't stick to it. They forget, they start, they fall off. So putting that plan together just helps you to focus,
Yes.
to be detailed about what you're going to do, when you're going to do it, and it fits into your routine. It has to make sense. It's personalized. Would you agree with that?
Yes, I really would.
It's absolutely necessary to have a self-care plan in place. Number 2, seeking support and counseling. Now, I recognize that everybody's support and counseling is going to look different, but it is very important for you to have a supportive network of people who support you, who encourage you, who care for you, because the work that you do, it is so profound and so important, and somebody needs to support you as you are supporting others. What do you think about that?
I absolutely agree, and I think having a plan in place so that when the situation arises, you can sort of fall back on that plan that's already in place. And I think just being able to, this is the way I look at it, I have to love myself.
Absolutely.
More than even I love my work, because I can't do my work if I'm not taking care of myself. So being able to really coddle, for lack of a better word, coddle myself and take care of myself so that I can. And I see that not only in my profession, but even, you know, as a mother, you know, as a wife, you know, taking care of me so that I can in turn genuinely take care of those that I'm trying to care for as well.
That is beautiful. So some people think if you take care of you, you're being selfish. Have you heard that?
You know, sometimes it's good to be selfish, because if I don't love me, who is going to really love me? It's going to be me. Nobody can love me like I love me. So if I can take care of myself, I can genuinely take care of others.
Yes, I agree. And it's just something about caring for people. Can you truly care for people if you're not caring for you?
No, that's a good question, and I say no, because you should be, I should be number one, and I can sort of set myself up to be a better provider or a helper or a caretaker for someone else once I take care of Janice.
Yes, I tell people sometimes, I'll jokingly say, if you love you, you will thank you for it. It's important to love you.
Yes, I agree.
And then the seeking of support and counseling. So it looks different for everybody. For some people, it might be a therapist. For others, it might be their physician, or maybe someone else, their psychologist or psychiatrist. For others, it might be their clergy. Or for someone else, it might be a mentor.
Correct.
But I do think it's important that we have someone who can carry our burdens, someone we can process things with.
True.
Now, I'm just thinking, I remember I used to wonder, how does a nurse see people suffering day in and day out without taking that home with them? Who do they go to unpack and unload? And so I think that's where that counseling, that support comes in, for you to release that tension or that sadness or that grief.
True.
Absolutely. The last thing I want to talk about in terms of how do we address and prevent compassion fatigue is the setting the boundaries. Now, you talked about that a little earlier, but setting the boundaries to ensure one's well-being while caring for others. I remember someone said that you can't pour out of an empty vessel.
Correct.
If you don't have anything, you have nothing to give, right?
That's true.
So this setting of boundaries, sometimes it's difficult to say no. Would you agree?
I do agree, but I think there again, experientially, when you sort of say that you have boundaries, but you don't actually enforce the boundaries, it's like, ooh, and I can certainly give you another example of that. My clients, the way that we communicate, we text or we call, and I set this boundary that, I'm on the clock, so to speak, from 8 to 5, so I don't work weekends, I don't work, at 10 o'clock at night, and so if I get a text, and I did get a text from one of my clients, like 10:30 at night saying, I can't take this anymore, and just going on, and it's like, do I take this, reach out to her, and then I'm going to be awake the rest of the night because of whatever she's going to dump on me? Or do I let her try to figure that out because she knows this boundary that I've set? And I decided to let it go. I felt like she was safe. She has a safety plan, so I knew she would be safe. But, my heart was saying, just go on and call her, just to make sure she's okay. But my boundaries were saying, you want to sleep tonight because you have other clients you need to see in the morning. And so I actually had that conversation with my supervisor after the fact because I didn't call her. And she's like, no, don't do that. And, ultimately the young woman was okay, but I just had that warring going on in me. But ultimately I made the best decision by setting and staying by those boundaries.
Absolutely. And I'm glad you mentioned that war. There's a war going on inside. That is one of the things that I discuss with my clients as well, that you have to ask yourself, what's the motive? Just ask yourself, why am I doing this? Am I doing this because I want to impress? And so sometimes, folks, we can get caught up in that impressing, wanting to look important. And that Messiah complex again, wanting to, people to think that I'm the savior of the world. I'm here to fix everybody's problem. People look to me, they depend on me. And I have to give them a rude awakening that if something were to happen today, God forbid, that you were no longer here, life would keep on rolling. And you think, oh, that's so cold, Dr. Starr, how can you say that? Well, it's the truth. We think sometimes we're indispensable and everybody has to depend on us and we have to fix it all. But life keeps rolling, doesn't it?
It does.
Absolutely. So it's it's okay to say no. You want to take care of you. And sometimes you feel that little twinge inside too. Have you ever felt that little twinge inside, like, don't do it, don't do it? And you have to listen. You have to pay attention.
Yeah, absolutely.
Yeah, and rest. And some people also say they struggle with guilt. That's another one why folks struggle to say no, because of guilt. And so you have to sometimes go a little deeper. And that's what we do as therapists. We go deeper into the whys. Why are you struggling with guilt? Why are you unable to love you? What's going on? And that has been very helpful. Just understanding the whys.
Yes.
Absolutely. So my question for you is, what advice would you give to nurses and healthcare professionals who are currently struggling with compassion fatigue, and to those who want to prevent it in the first place?
I guess what I would say to those that are struggling with compassion fatigue, to make sure that they are genuinely taking care of themselves. I mean, from a physical standpoint, making sure that you're eating and drinking water, making sure that you're just physically taking care of yourself, getting out and walking, doing things. Your social side, making sure that you're interacting and connecting with people that are upbuilding and are strengthening to you. If you're actually actively right now struggling with it, a lot of the jobs, they actually have mental health professionals that are there on staff that will specifically work with them. And there's no shame in saying, hey, I'm struggling, I can't do this anymore, I need help. And just to reach out, and also that spiritual side too, even making sure that you're connecting from a spiritual standpoint and just grabbing yourself as a whole. I really encourage that.
That's beautiful. Do you find healthcare professionals struggling with asking for help?
I do, because we think that we are the help, so why should I be asking for help? But the help needs help.
So what would you say to those people that are just struggling with perhaps pride? Pride can be an issue, right? You don't want people to think you're weak. I've heard that. I don't want people to think I'm weak. I don't want them to see me as weak.
But I'd rather you go on and, take that step and take care of you before you just totally dissipate or walk away from the job that you know that you loved and you cared for at some point. Just go ahead and it's okay. It's okay. And I'll raise my hand. I've been there. You're not the first one. You're not going to be the last one. And I'm not too proud to say that I struggled with it too. But I'm learning, and I use that term, I'm learning how to make sure that I reach out or, call someone. I'll call my supervisor. I'll call another nurse, someone that I know has the same experience, just to sort of work through someone, or even just to talk to somebody.
Yes.
But not to just keep it bottled up and just say, I'm gonna do it, and just keep going. And you're losing more and more of yourself as you keep pushing through.
Absolutely. Thank you so much for sharing that, Janice. I'm sure that's helped somebody today. I appreciate, again, you being here with us, and our time is gone. Thank you for joining us today, and thank you, Janice, for sharing your gifts of grace with us. Janice will be joining us next week, so tune in. We will discuss the benefits of self-care and share self-care nuggets for nurses and other helping professions. Until then, may you prosper and be in good health even as your soul prospers. Goodbye for now.